I remember sitting in the House of Commons earlier this year in 2020 on one of the few days that Justin Trudeau allowed Parliament to sit since the last federal election. And I remember asking our party asking Justin Trudeau questions about reports coming out of China regarding a novel coronavirus and what the government was going to do about it. I remember that. And I remember listening to the responses that the government, was echoing advice given by the WHO that there was no person-to-person transmission of it, that the risk was low, that border measures wouldn't do anything to stop the spread. The reality is that Justin Trudeau, Parliament has been suspended for a long period of time, but Justin Trudeau's costly and slow and dangerous initial response to COVID-19 can be measured in human lives lost, billions of dollars of debt, and millions of job loss in this country. And he needs to be held to account for that. This is something, what happened this year is something that he needs to be held to account for. It was not adequate. It's not adequate now. And now when I hear about the fact that the government's only plan to deal with the potential second wave of COVID-19 is, they're musing about potential more shutdowns after months and months and months of time as a government to be able to figure out how we keep the economy going, how we keep families together while combating the spread of COVID-19. No, we're pretty much no further along by any measurable standard than we were at the early part of this year. And that's got to stop. That has to stop. And I'm very pleased to have been asked to serve as the Shadow Minister for Health by our new party leader, Erin O'Toole. This was reported in the National Post today, and I'm very eager to hold Justin Trudeau to account, as well as his health minister, on these failures, but more importantly, provide a very clear contrast to all of you on an alternative plan to keep you safe while ensuring that the events and the small day-to-day activities that we used to take for granted, that really there's no hope for them on the horizon, that we can get back to that. When we look around the world, there are countries that are embarking on best practices on how to do this. Yet, what has Trudeau been focused on, right? He's had the We Charity scandal after scandal after scandal, had to dump his finance minister. He probed Parliament. Parliament isn't even sitting right now because he doesn't want to be held to account. And that's got to stop. I mean, there are so many of you, there are thousands of you who have written my offices or the office of my colleague and have talked about how you're out of work or that you're not seeing your family members. And at this point in history, after all of these months, Justin Trudeau and his health minister need to be able to tell you what the plan is to resume normalcy in our life. We can't just continue to hear news report after press conference where that plan doesn't exist. It's unacceptable. And I'm very pleased to be lending my voice and my experience to this role. The other reason why I'm really excited about this role is prior to entering politics, I spent several years working to help commercialize and manage early stage medical research at two major Canadian universities. And I also helped to form two major primary care healthcare networks in Alberta. So I do have policy experience in this area. So, to Justin Trudeau staffers or the political staffers that are in the health ministry, there's no more free ride, guys. You better get ready with a plan because you're going to be held to account. Enough is enough. And regardless of if you somehow allow us to sit or not, the Canadian public is listening and watching, regardless of political stripe. And I'm here to ensure that you answer those questions. And if you can't or won't, we will be providing them, under the leadership of Erin O'Toole, a clear alternative plan that allows them some hope that they are well deserving of. So I'm really pleased to be in this role. I'm really honored and I'm excited to work hard for you in it. Erin O'Toole announced his entire shadow cabinet today, and it is a remarkable team. I'm really excited to be part of it. I feel like our caucus is settled and united and ready to fight. And today we look like a government in waiting. And that's what you deserve. You deserve better than what Justin Trudeau is offering you. we're ready to go. And for those of you who would like to see a preview of me versus the current health minister, if you're watching this on my YouTube channel later today, I'll clip the last time her and I went head to head on the issue of their mismanagement of the COVID-19 crisis. Working hard for you. Stay tuned. Have a great day.
How many lost Canadian lives and jobs can be attributed to the government believing the following statement made by the WHO in January? There's no clear evidence of human-to-human transmission of the novel coronavirus.
The Honourable Minister. The Honourable Minister.
Sorry, I also was struggling to unmute myself. Well, thank you. As the member knows, this is a global pandemic, and the World Health Organization has played an important role in helping convene scientists and researchers from around the world to understand the science as it evolves around this novel coronavirus.
We'll go back to Ms. Rempel Garner. Ms. Rempel Garner.
How many lost lives and Canadian jobs can be attributed to Dr. Tam stating in January, quote, "It's going to be rare"?
The Honourable Minister.
Thank you, Mr. Speaker. As the member knows, we have been monitoring the coronavirus since we first found out about a cluster of unusual cases in Wuhan in December. At every step of the way, we've
go
been
back to Ms. Rempel Garner.
About the risk to their health and safety.
How many lost Canadian lives and jobs can be attributed to the minister's opinion that, quote, border measures are highly ineffective, or that, quote, border measures don't work at all in March?
The Honourable Minister.
Well, thank you very much, Mr. Speaker. And in fact, we've had measures at the border since
I think we're done for now. Is that?
I'm sorry, there was an interruption there. Somebody had their mute off. The Honourable Minister, continue.
Thank you. As I was saying, Mr. Speaker, to allege that there have been no border measures is actually untrue and misleading to Canadians. In fact, we've been screening arrivals at the international borders for quite some time, as the member knows.
Okay, go back to Ms. Rempel Garner.
I simply quoted what the minister said, so I think she just said that she was misleading Canadians. But how many Canadians' lives and jobs can be attributed that were lost can be attributed to the following statement from the minister? The risk is extremely low for Canadians. There's no need for Canadians to be alarmed.
The Honourable Minister.
As the member knows, the risk assessment that we were providing Canadians at every step of the way was posed on the actual risk to Canadians at that time. And as the risk changed to Canadians, of course, so did our assessment and so did our advice.
Ms. Rempel Garner.
Does the minister consider the statement, if we all stop moving for 2 weeks, the virus will die, to be COVID misinformation?
The Honourable Minister.
Well, thank you very much, Mr. Speaker. And in fact, we know that one of the ways that the virus is transmitted is, in fact, people having close contact with others. And I would argue that there is still quite a bit of work to do to remind Canadians that as we loosen our economy, we need to continue to physically distance.
When the minister stated, it's unfortunate that misinformation is creating a perception for Canadians that belies reality at a press conference, was she referring to the advice coming from her, the Prime Minister, and Dr. Tam?
The Honourable Minister.
Well, thank you, Mr. Speaker. The effects of the pandemic have had significant impacts on different groups of people in different ways. And I recall that particular conversation, in fact, and was talking about the particular effects on the Chinese Canadian community that was suffering from a high degree of racism.
Thank you, Mr. Chair. Given the literal failure of the government, fatal failure of the government to provide timely, sound advice to Canadians on COVID-19, would it be fair to say that Canadians should think twice before blindly placing their trust in this government when it comes to measures that take away their civil liberties, safety, and livelihoods?
The Honourable Minister.
Well, thank you, Mr. Speaker. And it's an interesting line of questioning the members pursuing. In fact, what's kept Canadians safe is Canadians listening to the advice of public health officials across the country who have been advising them every step of the way how to protect themselves and their families. And I want to thank Canadians for the extreme work that they've been doing to prevent the overwhelming of our healthcare system that we've seen in so many other jurisdictions.
We'll go back to Ms. Rempel Garner. Ms. Rempel Garner.
Does the minister support an unimpeded, full, independent global investigation into the origins of the coronavirus?
The Honourable Minister.
Thank you, Mr. Speaker. As the Prime Minister and I and many others from this government have stated, there is an imperative that we have a review, not only of the international response to the outbreak of COVID-19, but our own country's response. It's going to be a very important way for future generations to learn how to combat global disease.